So, Randy, let me begin with you on the question. This is actually the cover of the New York Post, Free the Smiles, because we've had this sort of domino effect just in the last couple of days. You had Delaware, New Jersey, Connecticut yesterday saying they're going to end the mask mandates in schools. Do you think that's a good idea?
Well, I think we have to be talking about the off-ramp for masks, and we asked for that conversation that's based upon science instead of politics back in November before Omicron. The governor in New Jersey made some pretty was pretty good in terms of the basis for it. He said that vaccinations are up in New Jersey, that the numbers, community spread is really low now, and the spread in schools are really low. Yeah. So, you know, what we asked for in November, and I'm glad you have Lucy on as well, is a metric that was based in science so that we could ultimately have an off-ramp for masks. No one wants masks in schools, not teachers, not students. But, you know, it's time in this COVID pandemic to actually do a little bit of planning based upon science as opposed to just announcement by announcement.
But we've got 2 years of science now, so we know it made a lot of sense, obviously, early on to have masks on in schools. We didn't know how dangerous this was, how it was transmitted in children. We've learned now since that while every death of a child obviously is a horror, that the percentage of overall deaths is infinitesimal. Children in the larger population, that it doesn't spread easily in schools, that so many teachers have been vaccinated or at least had the opportunity to be vaccinated. Now kids have the chance to be vaccinated. So at what point do we just say, okay, it's time to get rid of the masks? Isn't there enough science available already?
Well, that's why I'm saying that we believe in an off-ramp. I asked Dr. Cardona and Dr. Walensky to start planning for an off-ramp in November, pre-Omicron. But then you had the Omicron surge, and the masks were back on, and then the K95 masks were back on. So the real question becomes, how do we make sure that people can plan for it, and what are the measures so that everybody knows, so it doesn't feel like it's based upon politics. It feels like it's based upon making sure that there's no transmission in school. And it feels like the 4 or 5 different factors, which is what New Jersey used, are vaccination rates. That's what Massachusetts uses. Low community spread. Thank God Omicron is like down to 3% or so in New York and New Jersey. Low hospitalizations. And so I'm just asking the CDC to actually weigh in here so that we have that kind of guidance around the country.